In my practice, I'm fortunate that we have a large practice and a large patient following. So we see lots of patients with sinus complaints, but we see patients that come in with otitis externa ear complaint. And in the conversation, I just ask if they specifically don't describe it. Do you have midfacial fullness, pressure? You have a lot of sinus problems? And patients will volunteer, even patients that are not seeing you that day for that complaint. And I ask them to describe it. Is it recurring infections, fullness, pressure, headaches? And I just discuss that with them. You've been treated with antibiotics? Yes. Which antibiotics? Nasal steroids, antihistamine sprays? Yes, all of that, and it just keeps coming back. And then I tell them, I see lots of patients with the complaints as you've described, and we have a new procedure that we're offering now. It's a minimally invasive procedure called Balloon Sinuplasty. I can't promise that this procedure is going to fix your complaints. I can't promise and guarantee that it's going to alleviate the midfacial fullness and pressure. But let me tell you about my experience with over 250 patients that I have seen in the office that we have performed the procedure on in the office. These patients have complaints just as you described: midfacial fullness, pressure, recurring infections, midfacial headaches. The patients come into the office, they walk in. Generally we give no sedation by mouth. I don't inject anything in your nose. I put a numbing gel in your nose that numbs it. After I insert the gel, after a period of about 30 minutes, we introduce a lighted catheter that has a balloon on the end of it. I can introduce it into the drainage passage, the opening of the sinuses, and dilate it. It restructures, it reshapes that opening, makes a nice opening to vent it, to let it drain. We dilate the sinuses above the eyes, under the eyes, behind the eyes. The whole procedure, with you talking to me throughout the procedure, takes about an hour and a half. Minimal discomfort, no needles, no injection. You walk in, you walk out. And the procedure takes, as I said, about an hour and a half. When you leave the office, your nose will be numb for another 45 minutes to an hour. That numbness wears off. You'll get some burning, congestion as if you've been crying, maybe a little bit of bleeding, but minimal. Of the 250 plus patients that I've done, almost nobody requires any kind of narcotic for post-op pain. Most take just Advil, but we do prescribe something should you need it. The next day and over the next week, you'll have nasal congestion, but over the next 7 to 10 days, most of the congestion resolves. And we see you back 1 week following the procedure. Sometimes there's mucus and plugging and crusting that will remove that lets you breathe better. And then we see you back typically 2 months after the procedure. Only restriction after the procedure, you can go to work the next day. I just ask that you don't blow your nose for 2 days following the procedure, and definitely no swimming for at least 2 weeks following the procedure. Most of them say, can you do it this afternoon?